right, my name is Steve Beekman, and today we have Heidi Nelson from the Siouxland District Health Department here to talk about flu vaccines with the upcoming flu season. Heidi, how are you doing today?
I'm good. How are you, Steve?
Good. Can you tell us a little bit about your background and your role with Siouxland District Health?
Yeah, I've been a public health nurse clinic manager at the health department over the last year and a half or so. My role is to lead quality improvement efforts with our nursing programs, help support our public health nurses as they serve in our immunization, tuberculosis, and health maintenance programs, as well as some of the other things they do in the community to promote public health.
That's great. I know you guys do a lot of really great work in the nursing department, so it's really great that you can be able to talk to us a little bit more about this. Now with the flu season coming up and kind of on our way here then too, when should people consider getting vaccinated against the flu?
So we recommend people receive the flu shot by the end of October if possible. Flu season generally begins in October and peaks between December and February. However, I do want to point out that getting a flu shot at any point during the flu season can help prevent the flu, as sometimes the season can stretch out to as late as May.
Yeah, nobody wants to be getting sick with flu when spring and summer are coming up with that then too. So, are certain individuals at a higher risk for developing complications from the flu? And would you recommend that they receive a vaccination this season?
Absolutely. Anyone 65 years of age or older, children younger than 5 years old, pregnant women, individuals living in group settings like nursing homes or long-term care should all receive a flu vaccine. Certain health conditions can increase the risk of complications from catching the flu. People with certain lung disorders like asthma, COPD, cystic fibrosis are at an increased risk. Individuals who have a weakened immune system due to certain cancer treatments, HIV, or steroid therapy are at increased risk. There are other health and age factors that can put an individual at risk for complications too, so it's important for people to talk to their doctor if there's any reason for concern.
That's really great too, because that's something people who may be in those health complications or have some of those health concerns, it is really important that they do get vaccinated for the flu this season just so they don't have any more complications that exist with it then too. So can you tell us a little bit more why it is important to get vaccinated against the flu this season?
So most people who do get the flu usually recover within 2 weeks or so and won't require any medical care. However, people with high risk factors for complications of the flu can experience pneumonia, bronchitis, ear and sinus infections, worsening of chronic health conditions, hospitalization, and even death. So it's very important for people at high risk of complications to get a flu shot, but it's also important for people without high risk of complications to get a flu shot to help prevent spreading the flu to those who are at high risk and more vulnerable to these complications. The last flu season, there were a total of 89 flu-related deaths in the state of Iowa.
Wow.
So it's very important for everyone to get a flu shot. For healthy individuals, a flu shot comes with additional benefits like not getting sick with the flu at all. If a person gets a shot and still catches the flu, the symptoms are usually a lot less severe. Another benefit is reduced time off of work, which prevents loss of income, reduced time lost with family and friends because you're sick. So there are many benefits to getting a flu shot.
Yeah, that's the last thing people want to do is be sitting at home sick with the flu. If you're able to have some sort of time off or things of that nature, even during the holidays coming up, it's just nice to be able to spend time with family, friends, and hopefully be healthy at least at that point then too. So, can people get their flu vaccine at the health department? And what are some other locations that may be available where people can get their flu vaccine as well?
So we provide flu shots here at the health department by appointment. We charge $30 for the regular flu shot and $55 for the high dose flu shot, and that's for individuals who are 65 and older. We do bill Medicare, however, we do not bill any other forms of insurance. Children that are 18 and under who are eligible for our Vaccine for Children program, we provide flu shots for a minimal fee or free of charge if they're covered under Medicaid. We do not provide vaccines to children who are covered under Hawkeye. Children who are covered under Hawkeye would need to get their flu shot at their primary care provider. Most other pharmacies and physician offices in the area offer the flu vaccine. You'll need to call them and find out what they're pricing and whether you need an appointment or not.
That's just great information to know, knowing that they can access their vaccine here as well then too, and they may be covered by insurance depending on where they get their insurance from then too, so that's just great information to have, and knowing that there is very minimal barriers for people to be able to get that, I guess, then too. So if people want to know a little bit more about flu vaccine, for this season then too, where can they go, or where can they access some of this information that's available in the community?
So if you are wondering where you can find a flu shot, you can go to vaccinefinder.org. Also, the CDC's website, there's a lot of information on there about flu prevention and symptoms of the flu, how to prevent spreading the flu, just different measures you can take.
Yeah, especially when there was concern that some people were affected by it from the last year's flu season then too. So is there any additional information you'd like to share on flu vaccines for this year then?
One thing I do want to stress with everyone, if you do find yourself sick with the flu, make sure you stay home and avoid contact with others. Call in sick to work if you need to. Just remember you won't receive a medal or a trophy for working while you're sick. Stay home and take care of yourself. Make sure you wash your hands frequently. Cover your mouth and nose if you need to sneeze. If you need to go out in public, wear a mask, especially if you're around high-risk individuals. If you can, try to have a friend or family member go out for you if you need to have errands done. And while they're at it, out there for you, have them pick up some nice extra soft tissues for you, some medicine, and soup for you.
So those who are sick, just remember that too, that it's good for being able to help others with it as well too, and good information for other people then too, just so they know, like, hey, it's okay to take that couple days off then too, and maybe milk it if they need to, I guess then. So
just make sure you're ready to do the same for that person.
That's right. You have to give it back to them as well then too. You have to really put that back in there. So well, thank you so much, Heidi. Really appreciate your time today too. And if they have any questions or anything like that, would they be able to contact you at the health department then?
Yep, you can contact our nursing clinic with our, just use our main phone line, 279-6119. And you can also use that number to schedule an appointment for a flu shot as well.
That sounds great. And thank you so much for your time today, Heidi.
Yep, thank you.